RSPCA Cambridge's animal clinic is mainly intended to provide veterinary care for pets belonging to low-income owners who might otherwise not be able to afford a vet. It's also very important to the branch to treat sick, injured or neglected animals they've taken in for rehabilitation. Today, one of their volunteer foster carers is bringing in Star, a ginger cat, for a repeat visit. She takes him to the reception desk and he's added to the list of patients waiting to be examined. Last week, the branch volunteers were asked to catch Star because he was living outdoors on a housing estate and someone had noticed that his eyes looked very red and sore. He was given treatment for the sore eyes and blood samples were taken at the same time. Then, he was sent out to be cared for in a temporary foster home. Fortunately, tests on the blood samples ruled out several very serious problems, but his fosterer is concerned that he's very thin and not gaining weight, although he's eating ravenously. The reception staff are all volunteers, and most of them work one morning a week, starting at 8:30 in the morning and finishing about midday. They're responsible for booking animals in and checking owners' proof of benefit status in the case of owned animals. As Star is being fostered for the branch, he just needs to have his computer record updated to record that he's attended the clinic and to be added to the waiting list to be seen. If he'd been an owned animal, the reception staff would also have taken the required payment and issued a receipt. The clinic isn't free, but owners are charged approximately a third of what the cost would be at a private vet. Running the clinic is a very important part of the RSPCA's work in Cambridge, because it wouldn't be fair to prosecute people for failing to get treatment for sick pets if they genuinely had no possible way of affording it. Veterinary services at the clinic are provided by Cambridge University Vet School. The branch pays a yearly fee of £25,000 for this, but it is much less than it would cost to employ a private vet to do the work. The vet school benefits because the clinic is very useful for student teaching. Star is examined by 2 students who discuss his progress with a volunteer fosterer. He's very good. As he's so friendly, he must have had a home at some point, but scanning for a microchip doesn't give any results. All diagnosis and treatment is overseen by a qualified senior vet, but the students do an initial examination and then discuss their findings with the clinician in charge. After the students have presented their findings to the senior vet, she comments that hyperthyroidism, an excessively active thyroid gland, is a common cause of weight loss in otherwise healthy older cats. She demonstrates to them how to feel Star's throat for an enlarged gland, what would be called a goiter in a human patient. The students agree that they can feel a definite swelling, which is typical of a thyroid problem. Star will most probably have to have an operation to remove part of the gland to achieve a permanent cure, as it will be easier to rehome him if he doesn't need daily medication. Star will stay in branch care until he's fully recovered, and then he'll be looking for a suitable new home.